Hey Luca, so I want you to tell me about what you've picked as your focus, your question, and also what situation and task that you've picked.
Yeah, so my sort of topic is optimizing client participation. And so at the moment, I'm at Fiona Stanley on a respiratory placement, which I'm really enjoying. And the patient I'm going to be talking about today came in with an infective exacerbation of COPD. And he is a very proud South African man who you can pretty much tell has gotten his way, or at least moved through life with that sort of headspace, and will only really respond to authority and people above them. So you can sort of see where this is going to go coming in as a student. So yeah, initially I saw him in my second week, and supervisor was still there with me, and pretty much as soon as he understood that I was a student, everything was directed to my supervisor. I understand this is a pretty common thing to have happen, but yeah, so ultimately, was responding to more authority. My supervisor is very professional, very good, and knows how to talk her way through these things, whereas I definitely was a bit more shy. So yeah, at the beginning, definitely felt a bit useless, and yeah, I guess because he wasn't really listening to me, it felt like anything I was saying was pointless. And then furthermore, even with my supervisor, was denying physio. And a big reason we think this was the case is because he had a lot of symptoms of anxiety. So as soon as we would come in, his rest rate would increase and things like that.
Yeah. So talk me through your actions or involvement in this encounter. Like, what did you do to kind of break those barriers?
Yeah. So I mean, firstly, I was pretty frustrated and initially naturally didn't want to invest a lot into someone who wasn't looking like they were willing to help themselves. That was probably an initial thought. And it was super hard to get the foot in the door with him not really responding to me. So what I sort of first had to do was had to be really mentally present and sort of push those sort of feelings to the side and try remain professional. So I talked to my supervisor and got her feedback and her opinion on things. And then a few strategies. So another one was talking to the doctors about them approaching him when they're ward rounds in the morning and emphasizing how important physio is, because then there's an authority figure he respects. Really working a compromise with him. He sort of wanted to think everything was on his terms. So really working hard to compromise the time of the session, the time of day. So that would involve me going in earlier and saying, hey, you want to go now this morning or later? And if it's later, it means we're doing it later. And then also compromising the goals. You don't feel up to this? All right, we'll half it. How does that sound? It's better than nothing.
Yeah. Just getting into the results, how would you rate your personal and clinical performance throughout the scenario?
Yeah, I mean, definitely a bit biased, but I think ultimately it was really professional because I did, like I said, have those initial feelings and pushed past it and really tried to engage with the patient. He wasn't super chatty, but his wife was, and I made an effort to engage with her as well.
Yeah. Okay. And how did this make you feel? How did it make you feel of having a patient that didn't really want to engage with the student, and how did it make you feel that you were able to kind of break those barriers down? How did overall as an experience, how does that make you feel?
I think I'm incredibly happy and grateful for the experience because it ultimately he's still my patient now. He might be going to private hospital soon, but regardless, will ask me questions now, will engage with physio, just genuinely seems to have more respect for me, which has been amazing considering where it started, how useless and frustrating and pointless it all felt, to sort of pushing through that and getting gratitude also from him. He expressed some gratitude, and his wife as well.
Yeah, nice, awesome. So kind of we've already discussed it a little bit, but just kind of evaluating the situation. Like, let's start with so maybe just start with like your weaknesses, like something you could have done differently or a little bit better. Let's just start with that.
Yeah, I think it comes back to the sort of initial mindset where the initial resilience could be a bit better, because like definitely faltered a bit if I didn't have my supervisor like making me see this patient, you know, maybe he falls down on the priority list. I would like to think it wouldn't happen, but there's a very real chance it could have. And just that the patient attitude shouldn't really impact my quality of work. Like it might change what I do, but it should still, the patient should still have my 100%. And I felt like, and in the past, it's also been a thing where they're not particularly engaging and my energy drops as a result.
Yeah.
I feel like that needs to not be the case.
Nice. And just going on your, just what did your supervisor think? Did they give you any feedback on like things you could have done differently or better?
Yeah, I mean, they were actually just pretty happy with it because, you know, the supervisor said like, oh, hey, this is like your tricky patient, like sort of addressed him as being that. But then seeing him engage more and more with me, her needing to be in the room less and less, was really good. Yeah, so she's definitely on the same page with me.
Yeah.
In terms of that.
And you said your supervisor was happy, and what do you think your strengths were in this whole situation? Just and anything that your supervisor said in particular, like any?
Yeah, well, definitely the rapport building, being able to sort of switch my strategy up and, you know, talk to him differently to I would a sweet old lady who loves to engage with physio. I think taking my supervisor's feedback on board as well, any advice she was giving me, just being able to implement that ultimately quite effectively, I think. They seem to think of it as well. And just general passion, just like wanting to help and wanting to be better.
Yeah, nice, awesome. Yeah. So we kind of have this kind of already discussed it, but yeah, just what exactly would you do differently next time?
Yeah, I think a big thing as well that I would do besides not letting that sort of energy drop is show more initiative or be quicker at implementing different strategies. So for him, he wasn't mobilizing, he wasn't getting up and walking, but so then we started addressing airway clearance a bit more, gave him an ACBT with an acapella, got rid of a lot of sputum, and he goes, hey, this physio thing is working. So, but that was my supervisor that sort of wanted to initially steer into that direction. So myself being more taking initiative in that sense.
Yeah, no, so just kind of like just discuss like a bit of like the treatment you did. So you said you did some ACBTs with acapella, and that, like just kind of discuss that, like what, like discuss like that whole session, like how the results were.
Yeah, well, you could definitely see he wasn't particularly interested in doing this, you know, silly little breathing exercise at first.
He didn't want to walk, no.
Oh yeah, so he just multiple days going in there every time, compromising, making it on his time, and he every time would say no. Like it was always a battle. But then eventually we were like, okay, well we're not going to walk, so we're going to do something. And that was more on the supervisor's part, like I said. Like I was like, oh, well we can't do anything with it. She's like, no, let's take a different route. Ended up being insanely effective. He was coughing up a lot of sputum, and we gave it for him to do whenever he felt a bit congested. Say, hey, do 10 minutes of it until you cough up that sputum. You know, you'll cough less, so you'll be less sore and less tired. Sure enough, it's exactly what happened. And that's when I think a real turning point happened, because he saw it work.
Yeah, so kind of just a little bit of just a quick summary of just your overall learning. Like what is this, you know, a bit of like a tricky patient that doesn't really want to engage with you and also in physio. Like what have you learned from the scenario? Like how is this just going to help you the next time you see a patient that is maybe being a bit tricky and doesn't really want to engage?
Yeah, well, ultimately it's shown me how important optimizing that client participation is, that we sort of talked about at the beginning. And the way that I've seen that to be done is using different tools in your toolkit. So instead of just getting up and mobilizing, you have the ACBT at your disposal. So it's, like I said, showing initiative and grabbing a different tool out of your belt. Compromising and communicating with the patient, you know, something I already thought I was doing well in, but just how variable it can be. and that I can't let patient resistance impact my sort of pride in doing my job. And yeah.
That sounds great. Well done.
Sweet.